Hi everyone, today I'm going to perform a return demonstration of perioperative. So first we have to arrange a sterile field or sterile area. So first step is do the hand washing. Next is choose a flat hard dry surface. Next is open a sterile package or set and then use the wrapper onto the sterile film. So before we proceed or before we continue in opening of the sterile package, we have to keep in mind of the following. So first, do not cross your hands and arms over the sterile film. Next is touch the outside of the wrapper only. And then lastly, do not allow any non-sterile to touch the contents or the inside of the package. Now, in opening of the sterile package or set, it usually comes with two wrappers, the outside and the inner wrapper. So to open the outside wrapper, you can use your bare hands using your index finger and the thumb. And then in opening the inner package, it actually has two options. You can just open it here and then transfer the items one by one onto the OR table, or you can bring the entire package onto the OR table and then you can open the inner package there. So in opening the inner package, we cannot use our bare hands because our hands are not sterile. So instead, we need to use forceps. So I'm going to transfer the package onto the OR table and then I will open it here. So after opening the sterile package, the next step is to add additional items by placing them within the sterile field or sterile area. So let's say for an example, we are going to do a CS operation. So I am going to add a CS set. Okay, so in adding additional items onto the sterile field, so first you have to open the sterile package, or I mean the CS set away from the sterile area as much as possible. So we are going to do the banana peeling. And the next step would be we have to drop the CS set onto the OR table by keeping our hands as far from the OR table as possible. So we have to drop like that. So while doing this, we have to keep in mind not to reach over the field using our hands and arms as much as possible. So let's say for an example, I'm going to add a sterile gloves. So again, we have to open the item away from the sterile area as much as possible. And then we have to drop the item onto the sterile field by keeping your hands as far from the sterile field as possible. Next is transferring the sharps onto the OR table. So our sharps are usually soaked in a soap dish with disinfectant like Cidex. In transferring our sharps, you have two options or two methods. You can transfer them one by one, or you can do the fishing method wherein you have to hook the fingering of the sharps and then transfer them simultaneously onto the OR table. Now that we're done with preparing or arranging the sterile field or sterile area, next step is to do the scrubbing. So when is the best time to do the scrubbing? And that is when the surgeon is already in the dressing room. So let's now proceed with the scrubbing. So in scrubbing, the goal here is to perform the procedure in a sterile or speedy technique. So the first step is to prepare ourselves. So in preparing ourselves, first we have to wear a surgical suit or scrub garment. Next is to wear a cap or hood. a shoe cover, and a face mask. Next step is examine your hands and fingers for cuts, bruises, and blemishes. Next is remove bracelet, ring, and watch. And then lastly, remove nail polish, artificial nails if worn, and then clip nails so that it will not be longer than the length of the fingertips. Next is do the pre-scrubbing. So first, you have to turn on the water and adjust the temperature. Next is moisten your hands and arms and then lather them for 1 minute. Next is remove the sponge or brush onto the dispenser and then scrub the nails and then rinse after each nails. And then lastly, rinse your hands and arms by keeping your hands higher than the elbow. Next is do the scrubbing. So in scrubbing, we have two methods. We have the counted brushstroke method and then we have the timed method. But for today, we are going to do the counted brushstroke method. So first step is to select a sterile sponge or brush and then apply a liquid cleanser if necessary. Next is scrub the nails of the left hand for 30 strokes. Next is all skin surfaces for 20 strokes following anatomic pattern. So first is 4 surfaces of each fingers from the thumb to the small finger. So 20 strokes. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Until you reach the small finger. Next is over the dorsal surface of the hand from the small finger to the thumb. Over the wrist. Up in the arm, in the third ending 2 inches above the elbow. And then do the same procedure to your right hand and arm. So let's say for example, you're done with the scrubbing with your right hand and arm. The next step is to do the rinsing. So in rinsing, we have to rinse our hands and arms by keeping our hands higher than the elbow. Next step is to keep your hands in front of you, above the waist but not higher than the axilla, and then move towards the location of the sterile towel. Next step is to dry our hands and arms. So first we have to pick up a sterile towel, hold the towel and then allow it to unfold. Next is use the first half of the sterile towel to dry your first hand and arm. Don't forget to push the cuticles back as you dry. Next is use the second half of the sterile towel to dry your second hand and arm. Now that we're done with the scrubbing, the next step is to do the gowning and close gloving. So for the gowning, the first step is to pick up the gown by the neck edge. And then while facing the sterile field or sterile area, hold the gown from the inside top neckline and then allow it to unfold. Next is position the gown so that you are facing the back opening. Next is work your hands and arms into the gown to seam between the gown and the cuff. Next is turn your back to your assistant to secure the back of the gown from the neck and back, and then leave front tie tight. So before we continue with our gowning, we have to do the close gloving first. So with the use of your left hand inside the gown, pick up the right glove. And then hold your right hand palm up inside the gown. And then position the right glove over the right palm. Next is, with the use of your right hand inside the gown, grasp the bottom fold of the right glove cuff. And then with the use of your left hand inside the gown, pull over the right glove cuff over the right gown cuff. Adjust the right glove cuff over the right gown cuff, and then work your right hand inside the glove rather. Next is, using your right glove hand, pick up the left glove. And then hold your left hand palm up inside the gown, and then position the left glove over the left palm. And then using your left hand inside the gown, grasp or hold the bottom fold of the left glove cuff. And then using your right gloved hand, pull over the left glove cuff over the left gown cuff. And then work your left hand into the glove. And then turn up and adjust the cuff. And then reposition your fingers if necessary. Now that we're done with the close gloving, we can now continue with our gowning. So next step for the gowning is to untie from the waist tie, and then hold the ends above the waist, and then hold the short end on one hand, and then hold the longer tie out so that your assistant can grasp the thigh or the end with using a sterile forceps. And then next is turn around, wrapping the gown around you, and then retrieve the tie from your assistant, and then tie 2 ties in front. Now that we're done with the scrubbing, gowning, and close gloving, we have to keep in mind the following when working in a sterile attire. So first, we have to keep our hands above the waist level, below the axilla. Next is, we have to pass front to front, back to back with others wearing a sterile attire. Next is, do not turn your back to the sterile field or sterile area. Next is, change your attire if contaminated. Change or cover your attire if wet. And then lastly, warn others of your movement. So the last part of my return demonstration for the perioperative is assisting the surgeon for the gowning and gloving. So to assist the surgeon in the gowning, so you have to pick the gown by the neck edge, and then hold from the inside top neckline and with to unfold. And then in helping or assisting the surgeon doing the gowning, you have to show the opening of the sleeves, and then once the gown is already worn by the surgeon, you have to tell the circulating nurse to secure the gown at the neck and the back. Now, in assisting the surgeon in the gloving, so you have to put your forefingers underneath of the cuff, and then the thumb should be facing the thumb of the surgeon, like this. And that concludes my written demonstration for the perioperative.